So today let's talk about the growth scan. Hi, I'm Dr. Bajaj and I'm a fetal medicine consultant. And let's see, when should the growth scan be done? So ideally it is done between the 28th and the 30th week of gestation. Growth scan alone, I would say, would be inadequate. We normally combine it with a color Doppler, but we'll talk about color Doppler later. So as the name suggests, in the growth scan we look for the growth of the baby, whether the baby is growing according to the gestation age, whether the weight of the baby is exactly or around the same as it should be at this particular gestation. So it's important to check for the growth. The next thing that we look at is the amniotic fluid, because a normal growth is important, but a normal amount of fluid around the baby is also important. Have a good look at the placenta, whether the placenta is maturing fast. Sometimes you have a grade 3 placenta at 28 weeks, which may not be very good for the baby. So have a look at the placenta. If it was low lying earlier, whether it has moved up or not. We also look at the cervical canal, the length of the cervix, whether there is a chance of a preterm delivery or not. What is the presentation of the baby, whether it's a cephalic or a breech or a transverse, and then the doctor and you can prepare yourself accordingly. And of course, it is always better to combine the growth scan with a color Doppler, which is to check for the blood flow and in the different parts of the baby. But still, if at all you're going only for a growth scan, these points are a must to check. Okay?